2010 was an interesting year because the Affordable Care Act had been passed. There was a lot of uncertainty about what this would mean for a community hospital, because the reality was, for all of the money that we were spending on healthcare in the United States, we weren't always getting the best results.
Healthcare could be so much better, and the problem was not the people, it was the design of the system. So when I arrived at GBMC, it was clear to me that we were known in the community for being an excellent hospital with excellent people. Interestingly, the board had worked with consultants that generated a report that said GBMC had no hope of surviving unless they joined a big hospital company.
But the whole question was about whether you're going to stay independent, whether you're going to be consolidated, and outside of the financing issues, which are always an issue, sort of the independence, maintaining the independence was a big issue for people at GBMC and for members of the board.
I believe that we could set our own agenda and we could be successful at whatever we really committed to. The output of that retreat was to be a game plan to me as the chief executive officer and my team on where we were headed and what was the work to get us there.
We had little breakout groups that talked about what is your vision for what healthcare should be? What should we be trying to provide to the community?
In the conversation at the board visioning retreat, I believe it was Dr. Melissa Sparrow at one point said, we're talking about team-based care, and these teams should have as an organizing principle that they would be trying to deliver the care that we would want for our own loved ones. And the goal should be to do that for every patient every time. And that is actually built into the 4-paragraph vision statement that I call the game plan, that are my orders from the board, who are representing the owners, who are the members of the community.
But once we got to a vision statement that people were comfortable with, then the other pieces sort of over time have really fallen more into place, but we really had the structure for where we went from the vision statement.
The 2010 board visioning retreat was a milestone for GBMC. And it really was amazing how quickly the board came together on the key decisions around the vision and strategy. And those key decisions were to remain independent and focus on the community, to be driven by the community needs versus corporate structures and competing priorities, to embrace fully the accountable care model, put quality as the basis for our culture, and in all things, just put the patient first.
What was so clear at the retreat as a result of all the discussions was that we needed to be not just a hospital that did procedures, but we needed to create a healthcare delivery system that would take care of the members of the community for all seasons of their life. And it became quite clear that in order to do that, that all started with having a very robust primary care network.
So I was hired in 2011 at the completion of my internal medicine residency. At the time, as I was looking for opportunities to practice primary care, GBMC was really the system that was forward-thinking in their development for primary care model that was shifting to patient-centered medical home. This was the most comprehensive way to practice primary care. It was the most forward-thinking at the time, and it afforded me the opportunity to provide better care because I would be practicing in a situation with really more resources to support the goals for better patient outcomes.
And I think what's different here at GBMC in terms of primary care is that we really do concentrate on spending time with the patient. Where we look at it as a team approach, whether it's working with your physician or advanced practitioner directly, but we also have other partners within that team, which would include the care manager, the care coordinator, behavioral health, and it really does treat the whole person, whether it's body, mind, and just totally a focus on well-being and preventive health.
Never rely on technology as the immediate impetus for change. Get people together, redesign the work, and then use the technology as the accelerator.
In advanced primary care, we're working to be advocates for the patient and really assume a lot of the responsibility of what's necessary to provide quality primary care. We do this in different ways. One of them is really availability and access. So as part of a practice for advanced primary care, we have morning hours, evening hours, weekend hours. Within our system, we actually have an office available 365 days per year. And for patient consultation to meet immediate needs for urgent or emergent concerns, we have a provider available 24/7 to a patient.
I'm very proud to say that for more than 50 years, GBMC was known as a great community hospital. But today, we've taken it to the next level. We are a true community-based system of care that the patient actually experiences as a system, and it's that system that surrounds the patient to help them get to the best possible health outcome and the best care experience.
It's not lip service. We do it. It's not wishful thinking. It's not marketing. It's a reality. We walk the talk. We deliver on the promise. And that's what sets GBMC apart.